Booster shots aimed at the Omicron variant of COVID-19 are now being rolled out. But what about for kids 12 and under? Joining us now to talk about it is Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna COVID-19 vaccine trial. So let's talk about those boosters for kids 12 and under. When do you think they'll be able to get their shots?
Well, I think that's a really good question. And the easy answer is we don't really know quite yet. The trials for the boosters using the Omicron mRNA along with the original booster are all being tested as we speak so that we can determine both the immunobridging data, so we can see if the antibodies generated are powerful enough and what we're hoping for, similar to what the adults have, but also the safety of them. Again, we just want to make sure that when they do become available, they're the safest and most effective boosters that can be given to these children.
Yeah, you never want to rush anything, right? Well, now that the school year has started for most kids, the crud begins to creep into the home. My kids were in school for 1 week and all of us got sick. I'm still dealing with it. How can we avoid this, or is it just unavoidable?
Well, to some degree, it's unavoidable. Everyone's getting back together. The kids are playing with each other, whether it's in school or whether it's in sports afterwards, and they interact. They touch things. They're not always great about washing their hands. They share food, etc. You know, these are all things that we know can help mitigate the chances of getting sick. So, you know, keeping the hands very clean, not sharing food, not sharing glasses or cups. These are the kind of common sense measures that can be taken to try to help keep your family away from the crud, as you say.
My 4-year-old, I swear, she's always the one who's bringing it home. I joke with my husband that I think she goes around licking doorknobs or something. I don't know. But, you know, speaking to that point, I do have a 4-year-old. Do you think kids, especially young kids, 1, 2, 3, during the pandemic, not being exposed to anything for almost 2 years because of it, end up getting sick more easily because their body's immune systems haven't been built up during those high exposure years?
I do think that that's a possibility, and there is a theory going around that because the kids have been somewhat isolated for the past 2 years, their immune systems haven't built up to these common pathogens that are all around us. And so not only do they catch it, but they're more likely to get sick from them. And so we've seen it in my own house here. My daughter was sick this past weekend. It's not COVID, but it's just some flu bug that she picked up. She's not used to, and it made her a little bit ill.
I feel like we're all dealing with that right now. Question for you, and maybe you don't have an exact answer, but when do you think the pandemic will officially become an endemic? I know a study earlier this summer from Yale said not until 2024.
Right, and the answer there is very difficult because there's no criteria that really says that the pandemic becomes an endemic at this point. And so we have to just look for the time in which the virus is less intrusive in our lives and is more predictable. That study from Yale done in rats showed that they predict by 2024 about 15% of the population at any one time will have COVID, which is still a lot, but at least it's predictable and you're able to sort of count on it. You're able to know what the population needs are going to be at that point. We still have these periodic surges of COVID and the different variants, and it's very difficult to predict how these are not going to be part of a pandemic at some point. And so we're doing our best, but we're not quite there yet where we can make an accurate prediction.
Knowing what to expect, though, has to be reassuring, especially when it comes to doctors and scientists. So hopefully we're getting closer to that point. Dr. Bill Hartman, we always appreciate your insight. Thank you.
Thank you.